today?
I'm good. Yourself?
I'm very good. My name is Katie, and I will be your student nurse today from LCC, all right?
All right.
I'm going to be doing a full head-to-toe assessment on you. Is that okay?
Yes.
All right, can I have your name and date of birth, please?
12/29 of 2000. And Kenzie Carson.
All right, very good, Kenzie. Can you tell me where you are right now?
The hospital.
Hospital, very good. And can you tell me the year?
2020.
2020. Okay, so patient is alert and oriented times 3. And I'm just going to do a general assessment on you, okay, Kenzie, before I get started. So you appear to be a Caucasian female in your mid-20s. You appear to have adequate hygiene and grooming from what I can tell right now. You also appear to be appropriately clothed for the situation. You seem to have appropriate developmental status from my first few interactions with you, and I also don't see any assistive devices such as a walker, and I don't see any hearing aids or glasses. Is that correct?
Yes.
Okay, and like I said, today I'm going to just be doing a physical assessment, so I'm going to start on your head, I'm going to work all the way down, okay?
Okay.
And what brought you in today?
Back pain.
Back pain? Okay, how long has this been going on?
A couple weeks.
Couple weeks? Okay, and what kind of pain is it?
It's dull, kind of.
Dull pain? Okay, and does it radiate anywhere?
Up my back a little.
So is it in your lower back and then it can radiate sometimes?
Yes.
Okay. Do you have any other associations with your pain? Any nausea, vomiting, anything like that?
No.
Okay. And is it intermittent or constant?
Intermittent.
Intermittent? Okay. And does anything make it worse?
Exercise.
Exercise? Okay. And does anything make it better?
Just laying down.
Laying down? Okay. And on a scale of 1 to 10, 1 being almost no pain and 10 being the worst pain, what would you say your pain is at right now?
4.
A 4? Okay, very good. Well, I'm just going to clean my equipment off. And I don't see any current outward signs of pain. I don't see any grimacing. So that's at least good. Hopefully we can get the doctor in and we can figure out what's going on with your back and we can get you on your way, all right?
Okay.
So like I said, I'm going to just be assessing you, so that means I'll be listening to certain sites. I'll be touching around like in your abdomen area. And I'll just be looking around a little bit too.
Okay.
Alright, so the very first thing I'm going to do is I'm going to start with your face, like I said. Can you look at my finger, please? Very good, and again. Very good. And can you touch your hand to the bridge of your nose for me? Thank you. Very good. So pupils are 4 millimeters bilaterally, and your pupils are equal, round, and reactive to direct and non-direct light. So that's good. Do you mind if I pull down on your eyelids for a second?
No.
All right, sclera is white and conjunctiva is pink and moist, which is good. I'm going to palpate around on your face, okay? Tell me if you feel any tenderness or pain.
Nope. No. No.
Okay. Patient reports no tenderness upon palpation. So I'm going to look up in your nose really quick. And can you open your mouth for me? Very good. Can you lift your tongue up? Very good. Can you pull down on your lower lip? Very good. Can you pull up on your upper lip? All right, very good. So mucous membranes in your nose and your mouth are pink and moist. I don't see any lesions or cuts of any kind, okay?
Okay.
I'm also going to look in your ears. You said you don't wear glasses, correct?
Correct.
All right, I see no signs of skin breakdown. I'm going to look again in the other ear. I also don't see any signs of skin breakdown. Very good. Okay, so now I'm going to raise the head of the bed to 30 degrees. I'm going to carefully remove your pillow really quick. And I'm going to assess for jugular vein distension. So the head of the bed is at 30 degrees, and can you turn your head away from me really quick? Very good. And can you turn your head towards me? Very good. Negative JVD at 30 degrees. Lift that back. Is that comfortable?
Yes.
Okay, I'm going to lay the head of the bed back down. Now I'm going to listen to your heart, okay? So normally the patient would not be clothed, but for privacy, I'm going to keep her shirt on. All right, so now I'm going to feel for the second intercostal space, which would be the the aortic site, left sternal border. Very good. I hear no murmurs, rubs, or splits. S1 is louder than S2. Just to be sure, I'm going to palpate and correlate your carotid pulse. Yep, okay, that is S1. And again, it is louder than S2. And I'm going to count for an apical rate really quick, okay? Heart rate is approximately 66. So now I'm going to move to the pulmonic site. Also at the second intercostal space of the left sternal border. I think I misspoke earlier when I said that the aortic site was at the left sternal border. It's at the right sternal border. This is at the left sternal border. And this is the pulmonic site. Heart rate is regular, just as the aortic site was. I hear no murmurs, rubs, or splits. Heart rate is approximately 66. I'm going to move to the third intercostal space of the left sternal border, also known as Erb's point. Heart rate is regular. I hear no murmurs, rubs, or splits. S1 and S2 are beginning to equalize. S2 was louder than S1 in both your aortic and your pulmonic site. Heart rate is approximately 66. All right, now I'm going to move to the tricuspid site, which is the fifth intercostal space of the left sternal border. Heart rate appears to be regular. Heart rate is approximately 66. S1 is louder than S2, and I hear no murmurs or rubs. All right, I am at the mitral site of the left midclavicular line, fifth intercostal space. Heart rate is regular. I hear no murmurs, rubs, or gallops. Heart rate is approximately 66. And S1 is louder than S2. All right, so I'm going to flip my stethoscope to the bell now, and I'm just going to go through again, and I'm going to listen for any abnormal heart sounds. Most abnormal heart sounds can be heard best at your mitral, but I'm still going to go through all the sites just to double check, okay?
Okay.
So once again, I'm going to the aortic site. And the pulmonic site. ribs point. Tricuspid. And the mitral. All right, could you roll over towards me, please? Very good, you can roll back. All right, I don't hear any abnormal heart sounds at all. Is there any way you could sit up for me?
Yes.
Do you need help with your back?
No.
No? Okay. I'm going to listen to your lung sounds now. Is that okay?
Yes.
Can you breathe in for me? Very good. Very good. And now I'm going to listen to your back. Very good. Now could you put your your left hand on your head, please? Very good. Very good. And can you do the same with your right? Very good. Very good. Lungs are clear to auscultation in all fields. All right, now I'm just looking at your neck, the back of your head. Just looking at your shoulders and your scapula. Looking at your lower back really quick. All right, I don't see any lesions or bruises or marks on your back in any of your pressure point areas. Now, I know your back is a little bit easier or not as painful when you're laying down, so you can lay back down if you want. Okay. I'm also just gonna look at your extremities really quick. I don't see any breakdown or bruising or lesions in these areas either. I'm going to feel your extremities are warm proximal to distal. Your skin appears to be dry and intact and appropriate for your ethnicity. It looks to be palish tan with pink undertones. Now I am going to assess for clubbing. I don't see any clubbing. I'm also looking at your capillary refill. All right, very good. Capillary refill is brisk in both of your extremities. There's no signs of clubbing. Can you roll your wrists for me? Very good. Can you move your arms up and down? Very good. And can you raise your arms above your head for me? Very good. Okay, patient has full range of motion in upper extremities bilaterally. Can you pull my fingers for me as hard as you can? Very good. Can you press up against my hands? Can you press down against my hands? Very good. Okay, so you also have 5 out of 5 muscle and grip strength in your upper extremities bilaterally as well. Something I forgot to do earlier was I correlated your carotid pulse, but I forgot to grade your carotid pulse. So I'm going to do that right now. Okay. All right, carotid pulse is 2 out of 3 in both of your sides of your neck, so that's good. I'm also going to assess your radial pulse right now. Okay, your respirations are 14 breaths per minute, which is appropriate. It looks like you had a moderate depth and you had effortless ability to breathe. And from what I can see when I was assessing you while you were sitting up and while you're laying down, your AP to T diameter is 1 to 2, which is appropriate for you. I'm now going to assess your other pulse as well. So both brachial pulses are +2 out of 3 bilaterally. I'm now going to assess your ulnar pulse. Okay. Ulnar pulses are +2 out of 3 bilaterally as well. I'm going to assess your brachial pulses. They're also +2 out of 3 bilaterally, which is good. All right, now I'm just gonna lower the blanket a little bit. Is that okay?
Yes.
Could you pull your shirt up for me? All right, very good. Now I'm going to inspect and listen and palpate your abdomen.
Okay.
So, looking, I would also go around and look at on the other side, but from what I can see, her abdomen is flat and non-distended. So now I'm going to listen to your bowel sounds. Alright, bowel sounds are active in all 4 quadrants. Now I'm just going to palpate. Tell me if you feel any pain anywhere, okay?
Okay.
Feeling any pain?
No.
How about here?
No.
Here?
No.
Okay. How about there?
No.
Alright, very good. Patient denies tenderness upon palpation in all quadrants of the abdomen, and the abdomen is non-tender and firm. So now I'm going to assess your femoral pulse. Is that okay?
Yeah.
Can you bring your leg out to the side for me, please, and bend it like that? Very good. All right, I'm going to find in between. All right, yep, femoral pulse on your left side is +2 out of 3. I'm going to do it again on the right side. Can you do the same thing with your other leg for me, please?
Yes.
Thank you. All right, femoral pulse on the right side is +2 out of 3 as well. All right. So now I'm going to assess your lower extremities, okay?
Okay.
Alright, skin temperature is warm, proximal to distal. Again, color seems appropriate for ethnicity. Pink undertones, pale and tan. Skin appears to be dry and intact. I'm looking. I see no signs of breakdown in any of the pressure point areas. Very good. see no signs of edema. Your dorsalis pedis pulses are +2 out of 3 bilaterally. And your post-tibialis pulses are also +2 out of 3 bilaterally, which is good. There appears to be no signs of clubbing in her toes bilaterally either. And capillary refill is brisk. Can you press up against my hands? Very good. Can you press down against my hands? Can you press up? Very good. Can you press down? Very good. Can you move your ankles for me? Very good. If it doesn't hurt your back too much, can you bring your knees to your chest?
Like this?
Yep, very good. And back down. Very good. And can you bring them up again? And move your knees inside and outside. Very good. Okay, you can bring them back down. Okay. One of the last things I'm going to do for your legs is I'm going to take this little cotton swab and I'm going to lightly touch all the way down your legs with your eyes closed. Just tell me when you can feel it, okay?
Okay. No. 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 No.
Very good. Okay, can I have you set up one more time, please? And I'm going to take your blood pressure. Can you swing your legs this way if you can? Very good. Do you have any histories of any fistulas or mastectomies at all?
No.
Okay. Which extremity or arm, I should say, would you prefer me to take your blood pressure in?
This one's fun.
Okay. Alright. I'm gonna clean off this equipment as well. Alright. So what I'm going to do is I'm going to take what's called a two-step blood pressure test. So at first I'm going to measure when I can and cannot feel your pulse in your radial pulse, and then I'm going to actually listen for the blood pressure, okay?
Okay.
I'm just going to measure your arm really quick with the bladder. So I see it's 80 to 40, which is appropriate. Just gonna roll your sleeve up there for a second. Alright. Alright, I stopped feeling your pulse around 110, so I'm just going to add 20 to that, so I should pump up to about 130. Alright, I heard 105 over 72. Is that about normal for you?
Yes.
Okay, very good. Alright then, Kenzie, one of the last things I'm going to have you do, I know it hurts a little bit, but I I need to assess your gait and your posture, so I'm just gonna have you walk up and down the room really quick. Is that okay?
Yes.
Alright, do you need any help standing?
No.
Okay. Alright, can you just walk away from me and then towards me again? Very good. Okay, so gait and posture are erect and appropriate. Alright, you can sit and lay back down now. Is there anything else I can get for you?
No.
Okay, so other than placing a smaller pillow under her legs, which I would have done when I assessed her abdomen, and again, I would have normally listened and auscultated to her lung sounds and her under her clothing, but because she's being videotaped for privacy reasons, I chose to listen over her clothes. And that's the end.